Well, they say health is a very, very much important part in our lives today. I mean, health is everything, especially in this century that we're living in. And with me here is Jessica Nganga, and she is from the Kenya Hospices and Palliative Care Association. She's going to take us through this amazing program that is going on to assist people. And this thing is for life. You know, we don't even talk of you going to hospital and coming out. It's to ensure that you're having a good life all through as you try to recover from whatever illness. So you're very much welcome, Jessica.
Thank you.
So yes. How are you today?
I'm fine. Yes.
Yeah, definitely. So getting straight to the point of seeing Kenya Hospices and Palliative Care Association, what is it about?
Kenya Hospices and Palliative Care Association is the umbrella body that that deals with palliative care. It helps establish, and they are the overseers of palliative care in the country. Yeah. That is in Kenya. Yes. It is the umbrella body for all hospices and palliative care units.
Okay.
Yes.
So when we talk of palliative care, it might be a new term to maybe most viewers watching us. So what does it mainly entail?
Okay, briefly what I can say is that palliative care is the approach that we use to improve the quality of life of patients who have life-threatening illnesses and their families. Okay. That is now when we have done our assessment and we have established that the patient has a life-threatening illnesses, we use an approach that will help improve their quality of life. Okay. Yes.
So maybe can you take us through maybe some of the conditions in which maybe that necessitate palliative care?
Okay, fine. We have like cancer.
Yeah.
Patients with cancer will need palliative care. Patients with the AIDS will need palliative care, HIV and AIDS. Patients with the diabetes will need palliative care. Yeah. Patients with hypertension will need palliative care. There are so many illnesses that need palliative care. All those illnesses that we say, they are not curable. But for palliative care, we say they are not curable, but there is always something that we can do to improve the quality of life of the patient. Yes.
So definitely, it's a very, maybe a very enticing thing to know that you're trying to make lives better for people who are living with certain illnesses. Yes. So what are some of, so do maybe your conduct, maybe with the HIV/AIDS patient and with the cancer patient, do you have different activities that you do with them?
Okay, I think when it comes to the care and activity, it also depends with the patient you're dealing with. Yeah. Because you have to set priority. What is the priority of this patient? We do proper assessment. We establish what are the priorities of the patient. You cannot say that the way I dealt with the patient with cancer is the same way I'll deal with the patient with HIV. And even those that have HIV, it's not, you are not going to use the same approach because we all have different needs and even the presentation is different. So after assessment, that is when you establish how am I going to plan or what care am I going to give to this patient. Yes. Yes. So we cannot say that there is an approach for cancer patient. It is individual care. Yes. Yeah.
Definitely. And maybe you can take us through maybe some of the things that you do with these patients. Is it more medical or more physical, more social? What mainly do you maybe prioritize on?
Okay, when we refer to palliative care to a patient, it is holistic. Holistic in that we look at the patient in totality. You look at the physical part of it, you look at the psychological part of it, you look at the social cultural part of it, you look at the spiritual part of it. So every aspect of the human being, of the patient, you have to take care of. And that is why we say in palliative care, we use what we call team approach, whereby you have different expertise. I cannot do all those alone. I need people, I need a social worker, I need a counselor, I need a spiritual leader. I may be very good in the physical part of it, but not very good in spiritual. Yeah. And if from my assessment, I feel that the patient needs somebody to take care of the spiritual part of it, I have to have somebody who is going to give the spiritual care. So that is how we approach, we do palliative care. Yes.
Okay, so with maybe the list of patients you've had here and about, so what changes have you maybe witnessed in these patients? Do they become more positive? Does their health improve? Maybe how can you rate the activities that you deal in with palliative care?
Yeah, it's when patients come to us, I said we have to assess. Yes. Then you prioritize the care that you're going to give. But all in all, we have what we call daycare, or it is like a support group. So what we do when they come to us, we have to create time to educate them.
Yes.
As much as the disease is not going to leave them, we are not going to leave them. And all what we do is to improve their quality of life. So definitely, if a patient came with pain and you control the pain, the quality of life will have improved. The patient will not have pain. If the patient had distressing symptoms and you take care of those distressing symptoms, the quality of life will improve. If the patient maybe, the coping mechanism or the way the patient is coping with the illness. And because majority of the patients, once they are diagnosed with the cancer or any other disease, they just see death. So we try to talk to them so that they can take it positively. And if the patient, because the patient is the one who will guide us on the care that we are going to give. So we talk to the patient. And after we have done all this, majority of our patients are happy and their quality of life is improved. Yes.
Yeah, definitely. We can say for a fact that it has really helped a number of people, because what actually kills people is the stigma, the realization of that I'm going to die anyway. There's no need of maybe being careful with what I eat, what I do, or whatever activity that I engage myself in. So I think palliative care is a very amazing association that is really bound to assist many people. So let's talk about the event that's coming up on the 14th of October this year. So you can tell us, so what is it about and what necessitated the whole, the day that is to be celebrated?
Yeah, okay. Every year we have World Hospice and Palliative Care Day.
Yeah.
So during this time, you remember October is a cancer month. So this World Hospice and Palliative Care Day, it comes in the month of October.
Okay.
So we have activities that are set. They may be organized by Kehpca and also the hospices and palliative care units. They organize their own. So we may have them at daycare, where you have patients coming together, you talk to them. You also give them time to share the experience of living with life-threatening illnesses. Sometimes you go for home visit, you visit patients where they are, at least to be with the family members, talk to them, educate them about the needs of the patient and how to take care of this patient. We have hospices or units that organize for a charity walk. You are planned for a walk where you involve other people coming to walk with you, so that at least as you walk, you are creating awareness. Yes. Or sometimes what we do, we go to media like I'm doing right now. We tell them about palliative care, we tell them about cancers. The important thing is that we want to help the community to understand that there is hope. Once you have been diagnosed with cancer, that is not the end of it. Sometimes they go to the hospitals and they have received all the treatment, but they are told we cannot do much. So we want to tell them that that is not the end of life. We are there as palliative care providers and we work with the patient the journey until the end and even after, because palliative care does not just end when the patient dies. Remember, we are working with the patient and the family members. So we also need to support the patient even after the death of the patient. The family members, sorry. Yes.
Yeah, the family members. Okay, so maybe you can tell us what is the main objective that you aim to achieve after this day of the World Hospice and Palliative Care Day?
The main objective should be, and it is, that we have created awareness and many people are ready to go for screening.
Yeah.
You know, now with our community, going for screening is not a priority. They wait until when they have maybe a problem, there's pain or there's a swelling or there's something that has made them to go to the hospital. But you want to tell them, don't wait until when you have the problem. You can go for early screening. When the problem is detected early, it is treatable. Yes. Then even those who have it, at least we want to encourage them to go for treatment, and also to know that there is the other care that can be given. They can go to palliative care unit, or they can visit a palliative care provider wherever they are. So we want to create awareness. We want the public to know that there are myths and misconceptions. We also want to clear, so that at least we have a community that understands cancer and its management. Yes,
definitely. And so how does one maybe become part of the day? How does one maybe actively participate in being creative for awareness and also helping with other activities?
So when we talk of palliative care, it's not only for healthcare providers. It is for all of us. When we talk of the team, it is not healthcare providers team. It is the community, it is the patient, it is you and me. So it depends on how you want to support. I cannot tell you that when you come, this is what you are going to do. But what we encourage even our other people to help us in, it's create awareness. Talk to people. Now, like today, I'm talking to you. Once you have this knowledge, you can talk to other people. You can even talk to the church and tell them about cancer. So we want everybody to be involved. If we can talk if everybody can be talking about cancer, at least we have created awareness. People will go for testing, people will go for treatment, those who need to be treated, and at least people will understand. And we are maybe in future, we are going to have less cancer cases, or maybe palliative care cases. Yeah, because people already have the knowledge and they know where to go once they have a problem. Yeah.
Definitely, it's very amazing to know that there are some people out there who are out to assist. Whatever sickness you have, may it be cancer, may it be HIV and AIDS, things that maybe have no cure, you can always extend your life. Maybe even the period in which you're going to live can be improved, it can be made better, more amazing, and each and every day just make sure you know that there's someone out there who is out to assist. So the Kenya Hospices and Palliative Care Association is definitely doing a good job. We've witnessed maybe some patients having a very good life out there, especially even if you're living with sickness, it doesn't really mean that's the end. So we really do appreciate Jessica coming with us today on the Rise Today show. And we do hope that people will turn up for this amazing day and also create awareness. That is the main thing. Create awareness. Make people understand that cancer, you can live with it. You can improve your life no matter what. So thank you very much for joining us today.
Thank you.
Yeah, and we hope that there will be a success.
That is what we are praying.
Yes, definitely.